As a person reaches old age, various parts of their body start to slow down and just don't really work as well as they used to. Like the brain, for example. There's a lot of neural changes occurring as a person grows older. Like Alzheimer's and related diseases, for example, which are rather relatively common in old age, involve large changes in like declining neurotransmitter levels, the development of neuritic plaques, which are damaged or defective neurons that form around a core of protein. It's kind of like a scab tissue in the brain, if you want to think of it that way. And also the formation of a lot of neurofibrillary tangles, which are these spiral-shaped masses that form an axon's fibers that interfere with its ability to transmit information to the next cell. You also see a lot of changes in cardiovascular system. Incidences of heart disease increase dramatically as a person grows older, such as strokes. You could just call these cardiovascular accidents, which involve the interruption of blood flow to the brain due to some kind of blockage or hemorrhage in a cerebral artery. And you can tell when a person is going to experience a stroke by looking for what we call transient ischemic attacks. These are when the blood flow is interrupted, you see specific signs such as impaired speech, cognitive problems, physical problems, muscle discoordination, confusion, just to name a few. But usually the person looks like half of their body isn't really functioning anymore. You know, like you'll see half of their face start to droop down and they just can't seem to control that side of their body anymore. That's pretty common. And while a single stroke usually isn't going to be, catastrophic in terms of its effects, numerous strokes over a lifetime can start to produce what we call vascular dementia, which is very problematic, as you can imagine. Besides the cardiovascular system, you also see changes in the respiratory system. The maximum amount of air a person can take in a single breath will decrease about 40% from the ages of 25 to 85. And this is the reason why we stereotypically associate like this shortness of breath with people who are in their old age. Exactly why this change happens is still a bit of a mystery. We're still looking into what exactly is causing that, but one of the more obvious reasons could be just pollution, just wear and tear by, inhaling pollution. But whatever the reason for this, it is quite common for older individuals to just not be able to take in as much air as they used to. And this could lead to the development of what's called chronic obstructive pulmonary disease, or COPD. This is the most common form of incapacitating respiratory disease in old age. But my particular area of interest, what I did most of my research on, was the visual system. And there are some interesting visual system changes that occur in old age. Like typically, older individuals have trouble focusing on near objects. They have difficulty adapting to major changes in their light environment, like if they go from a very dark room to a very bright room or some other major shift. They have trouble just in general to see clearly. They've lost some of their visual acuity. In fact, visual acuity is something that we typically see decline steadily between the ages of 20 and 60. And a lot of elders do start to lose some ability to detect changes in color. Specifically green, blue, and violet colors. They have difficulty discriminating. And many of these developmental changes can in fact be corrected with using eyeglasses. Now, besides those normal changes that we see in the visual system with old age, there are some diseases that are pretty common in the aging visual system, such as cataracts, which are these opaque spots on the lens that limit the amount of light being transmitted to the photoreceptive cells. Now, if you were to be suffering from cataracts, what you would see is something kind of like this. Then there's glaucoma. Glaucoma refers to this disease in which the fluid of the eye does not drain properly, causing very high internal pressure that can damage the eye and cause a loss of vision. Here's what that would look like if you were suffering from glaucoma. Then there's age-related macular degeneration, which is this progressive and irreversible destruction of the receptors from any of a number of different causes. And here's what that would look like. It's variable from individual to individual, but here's a pretty good example of what it might be like. And then there's diabetic retinopathy, which refers to a fluid retention in the macula, detachment of the retina, hemorrhage, and aneurysms, which is often due to diabetes, as you could have probably expected. And here's how that might manifest. As you can see, with this particular example, we have what's called detachment of the retina, where all these little floaty things are actually little pieces of the photoreceptive cell that have started to peel off from the inside of the eyeball and just float around and start to obscure vision. So if you see any of these kinds of examples as you approach old age, or if you know somebody who's in old age and they start to complain about symptoms similar to what you've just seen, you should try to understand what that means. And especially if they start seeing floaters like this, you need to make sure they go to the doctor immediately, because damage is being done and corrective action needs to be taken right away. Besides the visual system, there are some changes in the other sensory systems, like the hearing system. Hearing loss as you approach old age is normal, and it can result in what we call presbycusis. I believe that's the correct way to pronounce it. This refers to losing your ability to hear low-pitched sounds. You may have noticed this in some of the elders in your life, where you go to visit them or you're just spending some time with them, and you can hear something and it's bothering you, but they have no idea what you're talking about. They've lost that ability to hear that particular frequency, that particular kind of sound. And this kind of change can occur for a number of factors. It could be due to damage done to the neural systems that are involved in hearing. It could be due to damage to the metabolic system, where your receptor cells just aren't getting enough energy to be able to process this kind of information. Or it could be more of a mechanical problem, where there's a lot of atrophy and stiffening of the receptors, like vibrating structures that actually detect that sound pressure, the pressure waves. Or it could be a sensory problem, where those receptor cells themselves just aren't functioning well. They're starting to break down and they can't transmit the neural signal as well as they used to. But whatever the cause, whatever the exact cause of that hearing loss, it is quite normal for adults to suffer from some hearing loss as they grow older. When it comes to the other senses, though, there isn't really all that much change we tend to see, or at least the change we see is not necessarily age-related. When it comes to detecting and distinguishing smells, we do see some decline after a person's reached the age of 70, and this is especially true of people suffering from Alzheimer's disease. And as you can imagine, this can be a very dangerous symptom, because if you can't smell things very well, then you won't know if food has gone bad, or if there's a dangerous gas leak in the house, for example. And another sensory change that we tend to associate with old age is elders suffering from bad falls. Older people do fall more often, and those falls are a lot more damaging because they have not only disturbed sense of balance and eyesight and hearing, but they also have typically weakened muscles and weaker, more brittle bones. So they're more likely to have a really bad fall for those kinds of reasons. Now, when it comes to chronic diseases of old age, not just normal kind of sensory slowdown and beginnings of malfunction, but when it comes to actual like diseases that we tend to see in old age, one of the most classic ones would be arthritis. Now, I've already mentioned arthritis in a previous video, but basically there's two kinds. You have osteoarthritis, which is this disease marked by gradual onset of bone damage with progression of pain and disability, together with minor signs of inflammation from wear and tear that typically affects the hands, spine, hips, and knees. And then there's rheumatoid arthritis, which is considered a very destructive disease of the joints that develops slowly, typically affecting joints in the fingers, wrists, and ankles, causing a lot of pain and swelling. And rheumatoid arthritis is the one that can actually, as it advances, start to fuse the joints shut so that they aren't joints anymore. You can't manipulate that knuckle, for example, anymore. Your fingers are just stuck in position. So, as you can imagine, that's highly disabling to the person. Another chronic disease of old age is diabetes. This is a disease that occurs when the pancreas produces insufficient insulin, and while there are treatments, we have not yet developed a cure. It comes in two types. So type 1 is something that develops earlier in life, and we typically don't really associate it that strongly with old age. This is the kind of diabetes that requires the use of insulin. Type 2, however, this is the one we typically associate with old age, and this can be effectively managed through diet. So as long as the individual is carefully monitoring their intake and keeping track, then they should be just fine. Another classic disease of old age is cancer. Obviously, cancer is something that affects older people to a much greater degree than younger individuals. This refers to this disease where abnormal cells divide uncontrollably and destroy body tissue. What's basically happening when a person who has cancer is one of their cells, because of normal mutation whenever the cells reproduce, one of their cells basically became immortal and never stops reproducing. It just reproduces forever. And this is why it's so deadly. And this is also why it's so hard to cure. Because if you go to the doctor and you surgically remove the cancerous lump, even if one little cancer cell is still left in there, it'll come back again. Because remember, that one little cell, it never stops. It's just going to keep growing and growing and growing until it crowds out all the other parts of your body and just kills the individual, unfortunately. So it's a very scary disease for that reason. It's incredibly hard to deal with. But there are things you can do to try to avoid the problem entirely, such as avoiding carcinogens. There's a lot of carcinogens out there. If you want to see a more full list, you can of course find it online. But basically, you already know a lot of these. Like, you should avoid spending too much time in the sun. You should avoid eating too much red meats. You should avoid smoking tobacco, inhaling gasoline fumes, and so on. There's a long list. I'm not going to go through all of it right here. Now, with regard to all these kinds of changes that are happening as the person grows older, there are two key factors for staying healthy. The first one is make sure you get enough sleep. Older adults do tend to have more trouble sleeping than younger adults, typically for mental health and physical issues. But it is incredibly important that as you grow older, you're getting a sufficient amount of sleep. Sleep is going to help you to just basically repair damage that's being done to your body throughout the day so that that damage doesn't just become exacerbated over time. Nutrition is the other key factor. older adults don't really have any special dietary requirements. They need, approximately the same amount of protein and carbohydrates as younger adults. But getting the proper nutrition, getting the proper amount of vitamins, like vitamin and like mineral supplements to make sure that they have a good, healthy, balanced diet, just becomes increasingly more critical. Now, I'm not saying you have to go out there and buy like vitamin capsules or anything like that. I'm just saying you need to make sure that you have a good, balanced diet. It's incredibly important as you grow older to have a good diet because you just aren't as resilient as you used to be when you were younger.